Yang deficiency is the opposite. They run cold, especially during the day or the yang time. For instance, with pancreas or spleen yang deficiency, the digestion and the bowel movements get affected. With spleen qi deficiency, that's the first stage before it gets worse, you just have poor appetite. You have a difficulty time digesting your food. Your stools will get a little bit loose. That's because the pancreas qi is not processing fluids and foods well, so you get more dampness. That happens. Like with that Ayurvedic example of the amma, the thick mucousy fluids. Okay. But as it gets worse, when it turns from spleen or pancreas qi deficiency into a yang deficiency, then it gets really cold. That digestive fire is really weak. So what happens? You can barely digest your food. Your stools will come down. They'll come out of your intestines. And there will be undigested food in it. Bits of undigested food. And that's because that fire of the digestive system isn't strong enough to cook the foods. Eventually turn into incontinence, where they can't hold it. Okay? When it goes as far as having incontinence, remember the kidney controls the two lower orifices. The kidney gets involved too. So it starts with spleen and then eventually will turn into yang deficiency. Okay. And when the kidney yang is deficient, there's impotence. Very cold all the time. Frequent urination. Good. So there's yin and yang.
What's BM?
Bowel movements. BM is for bowel movements.
Can a patient have the size of both?
Yes, they can, and it's much harder to treat. Because when they have both, what happens? If you add a little yang, let's say you think they're more yang deficiency and you add too much yang, then it burns out their yin. Or if you add too much yin, then it's too much for their yang to process, and it like drowns the yang fire functioning. So you have to go based on what you see in the tongue and the pulse and their symptoms, but also which symptom bothers them worse. Is it the cold symptoms that bother them worse? Or is it the heat symptoms that bother them worse? Is it the dryness or is it the cold? The heat or the cold? Whatever it is, whichever of those functions. Yeah. And then it becomes with acupuncture, it's easy. You don't have to worry about it. But with the herbal medicine, that's where, like I talked about before, that hot-cold balance is of the utmost importance. But what I've seen is that when they have, like one way to sort of get around warming them too much is that you focus on tonifying their qi to take care of their yang. Because a lot of times they're really fatigued. Then you can warm them a little bit, but don't overdo it. Yeah. For instance, if it's leaning that way. Or let's say they run, the heat symptoms are worse for the kidney yin deficient heat, then I'll focus on nourishing the yin and clearing the heat, but then I'll tonify their qi to help their yang, the yang functioning. But I'm not actually tonifying their yang directly. It's hard, much harder. Yeah. When I was fresh out of school, I like brought it to my mentor. I was like, what do I do in this case? And here's my ideas. What do you think? And they looked at the case and they're like, oh, yep, this is a difficult one.
How common is it? How often have you seen it?
It's fairly common. It's fairly common. It's much more likely, I'd say like 80 to 90% of the time, it'll be one or the other. But then as you get to old age, it gets more and more common.